Okay, so this is part two in a series related to cognitive health. So a few months ago, I had the good fortune to interview Dr. Ackerley and Dr. Sanders on the broad topic of cognitive health. You can view my interview on some of the links down below. But during that interview, Dr. Sanders said something that really resonated to me. Let's take a look at that.
One of the most important things about having a brain checkup and getting a cognitive baseline is that baseline is then something against which future comparisons can be made.
Okay, so this idea of us having a cognitive baseline throughout our life really made sense and resonated with me. So I naturally asked if I can take the baseline brain health assessment for myself with Sunday Health. And I'm just so you know, I'm 58 years old and I'm not on Medicare yet, but I was able to go through the process to pay privately and experience what the Sunday Health patients would experience. So, what I'm going to do is briefly share the experience with you and what I learned, and then how it's made me approach my cognitive health differently. So, first off, my first point of contact was a welcome call that I had with Kelly, who's a nurse care navigator. And she explained the full process in detail to me. She asked me about my goals, my concerns, explained the importance of the baseline brain health assessment and the value of having a brain health plan, and answered a bunch of questions from me. And then she asked me about my availability to take the cognitive test. And but we figured that out. And then she also assessed my comfort with like using technology, offered to coach me through signing up the compute for the computer-based assessment that I was going to take, logging into Zoom and actually being on a telehealth visit. And I really appreciated this because a lot of the people that I'm talking with that I'm referring to Sunday Health may or may not be, that comfortable with an online platform, and they might either need help or you need to sort of look at different alternatives. So I really appreciated that aspect of it, even though I was comfortable with the Zoom platform for my meetings and the testing. Um, so I received a summary of what we reviewed and the instructions for completing the pre-visit new patient questionnaire and the computer-based assessments, which to me were kind of like, brain games on the computer. Um, they included like interactive cognitive screening questions and asked me questions about my mood and what have you. Um, so Kelly also scheduled an actual cognitive test with Sarah, who's a nurse practitioner. And when I met with Sarah, she asked me about my goals, my concerns, my cognitive and medical and family history, medications, and then she administered a cognitive screening test. And after that test, I think we reviewed the results of my pre-visit computer-based assessment, and the I found out later too that my one meeting with Sarah, I would normally have been broken into two, and I think that's great. And but it was very informative. I really enjoyed going through the assessment, the conversations that I had with Sarah, and that was really good. Now, based on my results of my screening and the online test and my background and everything, this would have been the end of me setting up appointments with Sunday Health. I would have received sort of, follow up, my results. I would have worked with a nurse practitioner to develop a what they call a strength based health plan. However, since I wanted the full experience so I could share it with the families and individuals and professionals that I work with, I had an additional consultation with Dr. Sanders, who's a deeply experienced dementia neurologist. Now, this visit would have only occurred if there were any concerns or indications about my cognitive impairment, which I'm glad to report there wasn't. Okay. Um, so uh, I had a after that assessment, I received my results via email. There's no concerns about my cognitive health. Um, I I also had this, brief neurological assessment. That's great. I could share this with my general practitioner and what have you. But let me try to outline a few things about this experience. So, first of all, I was pleased and maybe even a little bit surprised at how well this was administered online. I actually think that it was much better than any meeting that I could have with a doctor in an office. My attention was focused on the practitioners. I could hear them clearly. And best of all, I didn't need to sit in a waiting room. So I'm a huge fan of this and other appropriate healthcare screenings or meetings being done online. They're so so that's the first thing. So the next thing was some of the cognitive tests that I took were challenging. I really felt like my brain was working in overtime a few times. And I know everything about brain training, and I I don't know if this will make sense, but this is how I kind of view it. This I sort of compare this to training for like a running race, like a 10K, where now that I've gone through this um, assessment, and it's just made me feel like I have a goal now to keep my brain working the same way that I would exercise my body and train if I was training for a 10K or a marathon. And that's just me. Okay. So, but one thing that I found that after I went through this assessment, I now try to weave in more activities to my day to work my brain. So I've been doing it for a while, but I play around with learning Spanish. I use a foreign language app. I do Wordle and some other games that really feel like it's challenging me in areas that I'm not well practiced. One of the things that I have done recently is I have these juggling balls, and I try to play around with these and juggle whenever I can, because just the act of my arms doing something and thinking about, where I'm going to catch the balls, I just feel like it's more intentional in exercising my brain. And, I'm reading more books now. I used to listen to all the books on tape, but I intentionally am trying to read more because I feel like I'm exercising my brain more when I'm reading than when I'm listening to a book. But a couple of other things that I've done based on this process, and I forget where it was in the process, but one of the practitioners asked me if I had had a eye exam or hearing test, and I hadn't in a long time. And so I got my eyes tested. I've got these awesome new eyeglasses that feel great. I really feel like that impacted my cognitive wellness, not wearing the best prescription that I possibly could. I'm signed up to have a hearing test shortly, and I know firsthand from all the families that I talk to and deal with that if somebody can't hear properly, they're not using their brain to the fullest potential. So that really are two other great things that came out of this process. So the bottom line is this was an amazing experience for me. I'm glad for my future health that I have this baseline now. And I certainly hope I don't have cognitive concerns in the future. But I think having this baseline will help me and my healthcare team diagnose and make better decisions. So I urge you to do some research, look into Sunday Health. If you're in the DMV area, they not only can you have the assessment like I did to get your baseline, but let's say that you've got a loved one, or if you're concerned about your cognitive health, whether you dementia, early cognitive, their team is the ones that I have worked with were amazing. And I think their process is very well thought out. And hey, the other great thing is that I didn't have to sit in a waiting room, and I had three medical appointments with no waiting rooms at all. So hope this is helpful. I'll make sure that when I upload this recording that I have links to everything that you need down below, and we'll see you at the next one.